shadow doctors all day. You get paired with the different ones and they take you around on all of their ward rounds, and you also go through all of the surgical wards and the clinics, and basically it's completely different every day because you never know what you're going to see.
I think it's unique because it's not like inside Cape Town, so we see people that really come from the townships.
The most impactful part of this experience on me has been just seeing, I guess, the problems that are present in this part of the world.
In the Victoria program was when I got a scrub into 2 different surgeries, a total knee replacement, a total hip replacement. The head orthopedic doctor is great at teaching everyone what's going on, and it's very hands-on.
So my favorite day at Victoria Hospital was the surgery day. I saw 6 surgeries.
My favorite day in the program was one of the surgical days where we got to see a foot amputation.
I would have to say one of my favorite days with the Victoria program. I got to do rounds in the morning with the doctor I've been with the entire month, and then I got to do home visits to different townships with this head sister with Abundant Life, and then that afternoon I got to go to the pediatric ward over at 2 Military.
My favorite day was definitely going on the home visits with Sister Patu. So we went out into the townships. We went to New Rest and Gugulatu, which I also went back to in one of the night clinics, and we just visited people in their homes, and it was just this amazing personalized experience that you don't often see in the hospital. People don't always have their families in the hospital, and so you can see just the patient as a whole, instead of a lot of times I feel like at the hospital they can kind of turn into a problem, or this is what we're going to fix.
Well, one of the main reasons why I chose this program was to get a better idea about how hospitals function here, and most of the experience I've had in the U.S. has been in private practices, so I was exposed to something that I had never seen before. I would say that here there's a big emphasis on family, the family support in medicine, and so I think that was something that's unique to South Africa.
The path that you take to become a doctor is very different, and the problems that people face here are very different. So I'd absolutely recommend this to my friends because everyone's very good at teaching at the hospital, whether it be a doctor, intern, or medical student, and everybody cares about making sure you know or you have a place to be in the hospital and that you're learning every day. So
I would definitely recommend this program to a friend because it gives you a unique experience in a secondary hospital rather than the ones we're used to in the States that are huge and technical.
So I would highly recommend the Victoria program to anyone who's interested in medicine in any capacity really, but especially those who are interested in being a physician. You get to see what medicine looks like in a different country, and you get to be a part of it. You form relationships with other physicians, and you form relationships with patients, and you just get to see a lot of things that you'll never see anyplace else.
Yeah, I would recommend this program to a friend, especially if they haven't had much clinical experience before, because you definitely get a broad range of everything. So I can go back to University of Chicago, School of Medicine, and be able to reach out to people and say, here I have experience at South African healthcare system, and this is what I'd like to do now. I think this experience is not really about us giving something to someone else, but about learning to receive what they're giving us. That's what medicine is. It's not let me fix you. It's let's learn together. So.
If you want to be a good doctor, you have to learn how to adapt to different cultures and different peoples.